Well, back here with Dr. Leigh from South Hadley, Massachusetts. Dr. Leigh, a dentist. How are you?
Good. How about yourself?
Not too bad. Thanksgiving is coming up. I can smell the turkey already.
Yeah, it seems like it snuck up on us. It seems like it doesn't seem it is. It's happened a little sooner this year.
Well, that's only because we're getting older, and we're having fun. So when you get old and when you're having fun, time flies, Sure. So, Dr. Hadley, let's talk a little bit about children and dentistry. What do you think that a mom should do or not do when she has a child, and the child starts teething, or maybe even before the child starts teething? So anyway, what are some of the do's and don'ts? Maybe there are some don'ts which mom consistently miss, and you may want to make them aware of. Tell us a little bit about it.
Sure. Well, I think the main thing with especially with the child, a toddler that's teething, is they're going to be drooling a lot. They could have a fever. They could be really cranky, and these are all signs of teething. So if that's the case, a lot of it is just comforting them, and just sometimes you could put a little Orabase in the gum, or if they're really in a lot of pain, you can give them maybe some liquid Tylenol or liquid ibuprofen, just to help just alleviate things. And as far as getting them in the habit of oral hygiene, even just using a washcloth just to get them in the habit of having their mouth cleaned, even if it's a washcloth with warm salt water or just warm water. Obviously, you don't want to use soap. You don't have to use soap, but again, a lot of it's just developing a habit pattern, so they're used to having a clean mouth, and by the time they have teeth, they want to have a clean mouth.
Got it. When do you think they should bring them first time to the doctor?
Well, generally speaking, the American Association of Pediatric Dentistry recommends that they be seen right around 3 years old, and even with those appointments, that's really just giving them a chair ride. We might polish their teeth and maybe take a look with the mirror. A lot of it is more just getting them comfortable in the chair. A lot of times they sit on mom's lap or dad's lap and ride the chair with them. Sometimes we just take them for a chair ride. But again, it's just having them getting them used to coming to the dentist and meeting the dentist, meeting the staff, and knowing that they're friendly faces and people that are there to take care of them and take care of their family, brothers and sisters, mom and dad.
So basically what you don't want to do is the child coming in the first time with a toothache, and you need to have that drill in front of their face the first time they see you, right?
Yeah, it's not the best case scenario. It's something we try to avoid.
I got it. All right. That's probably where overall some of the horror stories, we still, everybody, when he has a very big bad task in life, he says that's almost as bad as going to a dentist, right? Or it's as bad. Basically, we compare everything bad in life to a dentist, to a root canal, to a wisdom tooth, and do stuff like that. And it probably comes from the old times where people only went when it was all swollen up. And at that point, of course, you associate the pain you already had before, which brings more pain fixing it because it's also bad, with bad dentistry. And really doesn't happen today anymore with the way we can prevent and do things. All right. So let me ask you, what about bottles and the kids? I hear lots of data floating around there. It's good, it's not good, including the thumb sucking, is that something the parents should be paying attention to?
Well, regarding bottles, the main thing is that if they're given a bottle, that they're finishing what's in the bottle, whether it's milk or juice. I think the problem with what's called milk bottle caries is, the child will be placed in the cradle or in bed with a bottle full of milk, and they don't finish it, so the milk is just bathing their teeth, and there's sugar in the milk, and that's how the teeth develop decay, and they end up literally rotting out of their mouth. So the key is that they finish what's in the bottle. It's really safer just to, if you have to send them to bed with anything, just send them to bed with a bottle full of water. That's probably just the safest thing, and not really give them too much juice as it is. There's enough sugar in milk and just our normal juices, and even your normal orange juice or apple juice. Even if you dilute that, make it 50-50, so that they're not seeking or really looking for sugar at such an early age. That'll help prevent
I got it.
future problems.
So basically, you're saying that if the child sleeps with the bottle and there's still stuff in it, the child might like it, might fall asleep, but you now soaks the teeth in basically acid on sugar. Same thing anyway, but and that's not good. Kind of like we get told that we should brush. So now we do not brush, we actually soak them in the bad stuff. So, we brush so we get it off, but that wouldn't be good. Okay. So you suggest just get the kid used to fill the bottle with water if he or she really needs one. That would be the way to go, right?
That's the safest thing.
Okay.
Mm-hmm. Yes.
All right. Okay. All right, good. Now, another question about, in terms of keeping the teeth in it, as a child gets older, 5 years, 6 years old, whenever it is that the teeth start falling out. I remember when I was a kid, my father helped me pulling out some teeth with a little string, and he made fun out of it. We closed the door. And, how good is that practice? Basically, how important is it to keep the teeth in it and to have the dentist deciding this whole procedure? I mean, after all, those are primary teeth, they're gone. New teeth come out. Right. What's the big deal about losing them faster? Why do we need to maintain the kid's teeth in the first place is my question.
Yeah, it's really to maintain that space for the permanent teeth to come in. If you lose a baby tooth, then the teeth next to the tooth that you lost will shift and move into that space, and that may prevent that adult tooth from erupting. So the purpose of the baby teeth is to maintain the space for your adult teeth, and also for that child to develop the muscles necessary for chewing food. And that's also very important in development, is that that musculature that opens and closes your jaw to chew the food, that musculature is developed for an adulthood, because that will also prevent future problems regarding the development of the jaw and the positioning of teeth.
Okay, so basically, if the teeth come out too fast, or maybe staying too long also, then the other teeth cannot channel back up, and then your orthodontic bill is getting a little higher maybe, or something like that. It could happen.
Yes, potentially. I mean, it's not guaranteed, but it's something that's avoidable, and so you're not taking that chance. So that's the main thing. And yes, to avoid that orthodontic bill if you can. Yeah.
All right. Well, thank you very much, Dr. Leigh. Thank you very much.